Today's class will be basically write down all these points. You write down headed first, then I will explain it to you in detail before I come to this thing. Principle. 3 points you have to note down, 3 slides you have to note down. That you write only. So on the top you write down quantitative estimation of plasma glucose, and that is the exercise. Actually what you will be doing, that exercise on that day I told you that you have to take 3 test tubes. You write down this one. First you write down, because I am going from back to front, not from front to back, so that you understand what you are doing. So that you write down, this is what you are supposed to take. Write down. So this is what you will basically take. I'll tell you in the detail. You write down first thing, this thing, and then I will tell you some other things. This part I will explain it to you. Okay. This is try to understand the basic part first. The rest of the things you can one will be for blank B that I told you on that day. Blank will not contain anything, and one will be standard and one will be test. Okay, that part you have understood on that day. Now, since blank doesn't contain anything, first you write down, then a glucose reagent basically will be required. You make a chart. This chart will be common for all the tests. Only thing is that you have to, oh sorry, এটা 10 হবে গো, এটা 2টা কাটতে ভুলে গেছি, এটা 10 হবে, 210 না, এটা 10 হবে। এত তাড়াতাড়ি এডিট করলাম, because from this literature I had to edit it. This will be 10, okay? Don't write 210. So note down hurriedly, then I will explain. Actual experiment will be done by first putting the glucose reagent 1 ml. This is in 1 ml volume. So you take a pipette of 1 ml. 1 ml pipette is this one. You can see the white caliber. Can you see? This is a big one. This is small. This is a small one. So you will take this thing. This is calibrated to 1000 microliter. That means it is 1 ml. 1000 microliter means 1 ml. So you insert it, to put it like this, and then the reagent will be there. You take the reagent using this one, and then you dispense it. And then you take another one, dispense it, and then another one, dispense it. So this is 1 ml. Now next time what you have to do, you have to take this pipette. This is smaller pipette, that will pipette 10 microliter. Since this is higher volume, if you can take the other way around also. You can take the sample first also. You put it at the end. Okay. You put it at the end. You put it at the end. Either way you can do it. Only thing is that there must not be any contamination. Then you can add this one also. The way it has been written. First you take S and B, and then you add 10 microliter reagent, 10 microliter of distilled water in B tube, because B tube doesn't have anything. It is only distilled water, means it doesn't have any biochemical reactants into it. Standard means that standard known concentration of solution is there. Means some amount of glucose will be there, and that glucose will react with the reagent. Now this amount of reagent is fixed. That is 100 milligram per deciliter. Now, at the test tube, it is unknown. What is the concentration? That you have to determine. So, test tube, you will put also 10 microliter because volume is same. Now, you are adding the same volume to all of the test tubes. So, there is no discrepancy in the total amount. Only thing is that the reaction will take place based on the concentration. Is this part clear? Now, for every enzymatic reaction, you have to keep it for some time, for the reactants to allow to completion. And a standardized time is required. It might be 5 minutes, it might be 10 minutes, 30 minutes, 1 hour, whatever be the situation. That is a well-known protocol. And deliberately I have written with the coral colonical system because the reagents which you will be doing is from coral. Okay. So you have to see the what company reagent is there, and there is a package insert just like medicine into it. You have to read it very thoroughly. What is the procedure? That is written there, and that varies from company to company. Okay, here since this will be, you will be using this one, so deliberately I have written this one. I can show it to you. See, there are other companies which are also manufacturing the same thing. So you see the reagent here, volume is, they have taken it 20 microliter, 20 microliter, 2 ml, and then it is, reading is taken at 500 nanometer, okay. Here if you look at the volume, it is 20 microliter, 2 ml. If you divide it, it is again 10 microliter, 1 ml, this ratio remaining same. Only thing, what type of instrument you are using and what volume is required, minimum volume, that volume, I told you, this is the volume. That opening it must cover. Okay, so that will depend on the instrument, type of instrument, and what type of pipette you are using. That is the main issue. It can be 0.5 ml also, this reagent. Similarly, it can be 0.05 or anything, whatever you do. This is immaterial. And then there is a standard timing that it will be keep standing for 30 minutes at room temperature. And in our country, room temperature really varies very widely. Usually in the laboratory, AC is there, so average temperature is almost 25 degrees centigrade, something like Western country also. But Western country is cooler. The temperature is much less than 25 degrees centigrade. I have visited London, I have visited Ireland, so I have seen the day temperature is less than 25 degrees centigrade. Anyway, so this is I want to highlight. Then you, because if you take either 10 microliter first, or then you, if you add 10 microliter later, what you have to do, you have to use this test tube. Here the technical expertise is required. Now you have to either take the test tube, you suck the material properly. Then you have to be very careful in wiping out the outside, because outside some amount of, the moment if you dip it into a serum when you are sucking, some amount is remaining outside. That is an excess amount that needs to be removed. So you have to use it with a tissue paper very carefully, because by capillary reaction, if you put the tissue paper for a long time, some amount of serum will simply be soaked by the tissue paper. That art you have to say, practice. That is the one, because if out of 10 microliter, if at least 2 microliter is sucked, that means you are making an error of 20% right now, even the sample itself. So it will, measurement will be error. So that part, if you don't do it, then the excess amount of glucose which is there on the outside, that will also get mixed. So you have to be very careful in dispensing it to the side of the test tube. Very carefully, punch it just little above the solution. Or you can touch it also with the solution, no issue, because this tip will be exclusively used for this one. Then you mix it. You take this thing once more, but entire inside material will be washed out. Then you shake it. Mix well. Keep it standing. Same thing for standard that is 100 milligram, that you take and dispense it. And then mix it and keep it. Test tube also. In the test sample, suppose I have taken your blood, he has taken your blood, all these blood, the samples are kept serially, so serial numbering is there. So on that test tube, do the same thing in the same way, then keep it standing. So what happens basically, you have to keep it in the test tube stand rack. I mean, categorically what I have written, what you will actually do. So your three numbers are there, T, S and B. Suppose T, S and B is here. And you have collected some samples also for analysis. So the samples, if you want that, I want to keep this test blank and standard like this, and samples like this. So today 5 samples have come for analysis of glucose. 5 tests we have taken. Why I have told you glucose to dispense glucose reagent first? Because using one tip, you can use this entire reagent for dispensing, so there is no contamination. Now, if you want to do it subsequently, you have to be very careful, because by chance if the tip touches the sample, because sample is there, and if you dispense it will contaminate, and the entire reagent will be contaminated. Do you get my point? That is the reason I am telling you, dispense the reagent first, so that you don't make any contamination, and then you add the sample. For each sample you have to use a separate tip, because your blood sugar might be 400, his blood sugar might be 900, and his blood sugar might be 300. Now, if I use it, suppose yours is 400 and his is 100. Now, if I use it and if you don't wash it very thoroughly, again washing will take good amount of time. It thoroughly has to be washed. If it is not washed properly, suppose her blood sugar is 100, and it will simply reflect 130. Unnecessarily 30 milligram will be there, because her blood sugar level is 300. It can be 400. So there will be contamination. It is better to take a fresh tip, so that you need not require to wash it thoroughly and discard it. Simple. Okay. If you take distilled water, then since distilled water doesn't cost anything, you can, with the same test tube, you can use the standard. You can use also the test sample, one test sample. So one tip can be saved. That is technical issue. You understand? Now, in that reaction, you allow the reagent to react, and that reaction time will vary. If you keep it at room temperature, since the temperature is low, you keep it for a longer time. If you increase the temperature, reactions will take place at a faster rate, the timing will be less. So, if you keep it at 37 degree, then the timing will be 10 minutes. It can be 5 minutes also. That needs to be standardized. That you have will be written in there in the literature itself. Now, then you have to, a color will be developed, because I told you colorimetric estimation will require a color. So, glucose, what is present in that solution, you don't know. What is present in the plasma, you don't know your blood glucose level. So, here what happens in the standard tube, the 100 milligram blood glucose is there, this 100 milligram is there. So, that means 100 molecules of glucose is there. So, 100 molecules glucose will react with the reagent, and it will produce a color. Now, if somebody's blood glucose level is more than 100, 150, so again the intensity of the color will be more. And if somebody's blood glucose level is 75, the 75 molecules will react, so color, less intense color will be produced. So, from the color itself, since you know the concentration of the standard, you can have a rough idea what I have demonstrated you with potassium permanganate solution. You can have a rough idea, and if you don't get the desired reading, then the machine is not functioning. Okay? So, visual estimation is possible also, and then actual estimation will be done by colorimetrically by using the formula. You will have to take a reading. The basis of taking the reading, I have explained it to you at what absorption, when the absorption is maximum. Then that is standardized depending on the type of filter whatever you are having, whether it will be 505 or 510, 520 or 500, whatever is there, that needs to be standardized. Suppose the company has written 500 nanometer. It is written in the literature. Now, your calorimeter is having 500. So, you have to set it in the 500 and adjust it, calibrate it like this. You are having the minimum is 520, closest 520. So, 520 you set it. These are all, I mean, adjustable things. I mean, these are the extra thing I am telling you. Now, in reality, you will not use in this colorimeter. You will use a spectrophotometer, semi-auto analyzer. Here I have checked it, that you keep the reagent standing for 10 minutes at room temperature, and then take reading at 500 nanometer, because this will be set in the instrument, and you will get an OD reading, and from the OD reading we will calculate. Okay. Now, what will be the calculation? Because of the depending on the reaction. So, this is what I have explained it to you on that day. Now, you will take a reading. I am going from back to front again. So, either you set the colorimeter to 0 with the blank, or you set it with the distilled water at 0 and take the reading of the blank. What is the reading? Do you get my point? So if you take the reading of the blank, then you have to subtract it every time. If you set the machine to 0, then there is no need, because it is already 0. So then you have to take the OD of the test. The best procedure to take a colorimetric reading is whose intensity is more, that you take at the end. If the intensity of the standard is high and the intensity of the standard test is low, then you take the reading of test first. Okay, that is, tips what I am giving you. Otherwise, you have to wash this test tube very thoroughly. That cuvette, that small cuvette, what you are using it, that you will be using in the machine, that you have to do it. So then OD of the test will be there, you subtract it, and OD of the standard you will get it. Now a concentration of the standard is there, it is already well known, and you will get basically ODT by ODS into 100. And at the end, don't forget to write down what is the concentration of the unknown sample. You write it completely like this: result concentration of the glucose, urea, cholesterol, whatever in the test sample is ... whatever result you will get, and that will be in the unit will be what is the concentration of the standard solution. Standard is there, concentration is there. I have told you that is in 100 milligram per ml. So milligram per deciliter. So that milligram per deciliter will be used here. Okay, if it is millimole per liter, then millimole per liter. If it is microgram, then microgram. That unit will be defined by that concentration of the standard. Okay, so this is actual what you will be doing in practice. Now, what is the magic in it? That is now I am trying to explain. Now, there is a reagent in the box. So this is the reagent. Okay. So this is the reagent, this is the standard, 100 milligram. So from here you will open the cap. Yeah? You see this, always you try to make it a point that you shake it a little, because there might be some sediment, and this is a homogeneous material, it is a heterogeneous material. Why I am telling you, it is not in pure solution. Suppose if you take glucose, it will be in true solution. If you take sodium chloride, it will be in true solution. But this is a colloidal solution. Why it is a colloidal solution, I am telling you. It will not be that a pure solution. So better to shake it. One thing will happen, some frothing will be there. You avoid that frothing. Okay. Then you shake it, you open the cap, and since this the whole lot is there, it must not be contaminated. You have to be careful, because once you do this thing, then the entire reagent is gone. Either you decant to a smaller test tube or smaller container, so that the reagent is saved. You will get some idea how many samples are there, how much reagent you want to use it. Once you take it, you cannot put it back inside this thing, because the entire reagent will be contaminated. Suppose we have taken, there are 5 samples, and you have taken something around 6 ml of reagent. So 1 ml extra is there. You keep it stored in the refrigerator with that test tube. Next day you use it for another sample, but don't put it back here. These are the minor things I am telling you. Okay, just like some dal, what you have taken for today, there is a stock, you have taken for distribution of some 10 people. Now, you have taken some amount more, which can be given even 2 more persons. Now, that extra amount of dal which is there, you are not going to put it back into the main container. You will keep it separately. It is just like that. Okay. Then you take it, and with that pipette, with this large pipette, you take 10 ml and dispense it. And then this is standard tube. This is 100 microliter. Now, here you put it here. You take it. Where is the small one? The small one. Again, you have to be very careful. This is standard solution. You cannot contaminate it. You open it, or there will be a procedure. Suck it. Or because the TP has been given, you will be provided with a small test tube, so that this thing is protected. This is the actual material. It is just like a weight, say 200, 100 milligram, or whatever you see. For gold, suppose if there is a weight, so that weight, particular weight cannot be, manipulated. And here it will basically the same thing, no contamination. So this part is clear. Okay, now coming to this thing, what is there inside this reagent? Okay. First you understand this one. Okay. So the method which you will be using is basically a glucose oxidase peroxidase reagent called God pod. I will tell you in detail. For the timing you write down. These are the 4 important things I am telling you. Whatever has been written in the red, that is what you actually be participating in the reaction. Because for any enzymatic reaction you require a buffer. Because you require a certain pH. That pH has to be maintained. And this is the pH of 7 point, and what will be the strength of the buffer, that is standardized. So that part you need not require. Only wanted to highlight that a enzymatic reaction takes place at a particular pH, and that pH is maintained by the buffer. So in this big solution, the major amount is the buffer. Okay. Now, since this is a glucose oxidase peroxidase method, so glucose oxidase will be there. As I have taken this thing as what is written in the literature. These units might vary. For your own understanding purposes, I have written. So peroxidase is an enzyme which is present in this concentration. You need not write all these things. Okay, you write the name only. Best. Okay, pH you can write down. These are minor details you are not supposed to write and supposed to know also. I am informing you for your own understanding. Because this might be 20 in some region, this might be 30, this might be 50, whatever you don't know. This might be 1,000, this might be 500, this might be 1,500, 5,000, what is it? That is the company will decide. 4-amino antipyrine. Because you see why I told you this is not a simple solution. If you would have put phenol, it would make a true solution. Glucose oxidase is an enzyme, peroxidase is an enzyme. It is a large molecule. It will not enter into the true, it will not make a true solution. It will make a colloidal solution. Okay? So that is the reason a true colloid is there, crystalloid is there also. So that is the reason why you need to shake a little bit to mix it uniformly. Where in course of time that molecule might settle, high molecular weight might. Do you understand? And then, because this I told you in the earlier class that reagent must be stable for some time. So you have to add some stabilizer. So some detergents are required also, and also the preservatives, just like your packaged food. Some preservatives are added. But these are the things which has to be chosen very carefully so that it doesn't interfere with the main reaction. Because you have taken a detergent now which is falsely reacting with suppose cholesterol or urea, then the purpose is gone. So one has to be very much careful about selecting all these things. So these are the minor aspects, these are not told at all in any one of your class. You understand what is the basic fundamental code now? Basically coming to the principle, you have to tell it in one spell. Now using this method, basically not only plasma glucose will be measured, but other body fluids like cerebrospinal, write down completely. It can also be done from serum. The difference between plasma and serum is that plasma contains fibrinogen. Serum doesn't contain fibrinogen. Otherwise, you will not be able to finish it, you will not write it properly. While you are writing, you try to understand each and every point, each and every word. I am there to explain everything. So, in the body fluids, glucose is also present, like cerebrospinal fluid, which is, bathing the central nervous system, brain and the spinal cord. And ascitic fluid, sometimes fluids accumulate within the abdomen. That is called ascitic fluid. Sometimes fluid accumulate in the peritoneal cavity, pericardial cavity, but this is covering enclosing the heart. So if there is an excess amount of fluid, that will cause disease, and that fluid needs analysis for actual confirmation of the disease. and their glucose estimation is required mandatorily. So using this method, glucose can be measured from this fluid also, not only blood. Okay. So that is the purpose why I have written it. Now principle. First you understand. In the clinical setting, always we take plasma as a reference sample, not serum. There is a reason for it why we take plasma, because serum is not recommended sample, but in case of emergency you can use it. So that is the reason I have written plasma glucose. Okay. Now in the first step you see, look at the reaction now here. Forget about writing, look at the reaction first. Glucose is present in the sample or standard. It is reacting this in presence of glucose oxidase with oxygen, and then it is producing gluconic acid and hydrogen peroxide. Okay. Now in the first reaction, if there is a 1 molecule of glucose, 1 molecule of hydrogen peroxide will be produced. If there is a 5 molecule, 5 hydrogen peroxide, 100 molecule, 100 hydrogen peroxide. Okay. Now this peroxide, whatever amount is formed, is reacting with amino antipyrine or aminophenazone. 4 amino antipyrine is there in the reagent. You should look at the reagent. And the phenol is there. So that is basically a colorless compound. We have to make it color to quantify it. So now we are making indirectly allowing the reaction to occur to make a color. So basically now the H2O2 which is formed will react with this one in presence of peroxidase, and it will form a quinoamine dye which will be pink color. Okay, just you have understood this one. Now in the first step, now you come to the reaction first, because I am in the habit of going from back to front. Now in the first step, this is the first step. Glucose present in the sample, either plasma, serum or any body fluids, is converted into gluconic acid and hydrogen peroxide by the glucose oxidase present in the reagent. Is it okay? In the second step, hydrogen peroxide reacts with 4 amino antipyrine or 4 aminophenazone and phenol to form a pink colored quinoamine dye. Is this part clear? Anybody having any confusion? Now the intensity of the quinoamine dye, there will be intensity, it will be less intense, it will be more intense, is proportional to the amount of glucose present in the sample. If it is less, then it will be less color. If it is more, then more color. But to assess that thing, you are having a standard in front of you, which is giving some color. That 100 milligram of glucose has given this color, and this test sample is giving either less color or more color. If it is less color, then you will get less OD. If you get more color, you will get more OD. Okay. Now this color of the solution is measured colorimetrically at 500 nanometer, 505 nanometer, whatever you see. 505 you make it 505, because this was copied from that dash reagent. Okay. You make it, write it at 505. Okay. And whatever will be shown in the instrument, that you note down that particular wavelength, because I don't know about this particular instrument, because every instrument is having a different calibration. That you note down in the laboratory. Basic principle is understood. Okay. So what I have written, this is I have come to the first slide first. Then I am going to the second one, the composition of the reagent, the basis of reaction, and then we are going to the actual experiment which we will be doing. And this is another company's reagent. If you take further another company, there will be some different. So calculation I have told you. This is the actual experiment, you will do it. Okay. Now one thing I am telling you that you must remember throughout the rest of your life, because none of you are going to do this test. It will be done by the technician. If you don't know the actual mechanism, then where the technician is making the mistake, you will never know. Because he will give a report, or most of the laboratories are run by the technicians. and they are not that much intelligent like you, so they are likely to commit mistake, then you go to the laboratory, show me how you are doing it. And if you know it, then only you will be able to detect it, otherwise he will make a fool out. The moment you understand, he understand or she understand that you don't know anything, he will explain in his own way and you think, fine, okay. He will be smart and he will expect that figure and he will make a wrong diagnosis. Now, actually, what is normal value? What is abnormal value? So for which there are two organizations. During our MD study, even after that till 1997, World Health Organization used to give a criteria. And what is the criteria for normal? What is the criteria for, what is the criteria for diabetes? At what blood level we will tell that the patient is having diabetes. Okay. Later, American Diabetes Association came to the picture from 1997, and they are making every year in the month of January, they publish one article on ADA guidelines, that is American Diabetes Association guidelines. These guidelines are almost same. You read at least one issue completely, and the next issue will, see what are the changes made. So right at this moment, you are not required to do that thing. You, after passing, while you are in the clinical years, you read it only at least one journal, latest journal once, and you can go back to the previous one, 1997, what was written in the 1997, how it has evolved, what are the changes. Now, every year they are changing, means there are some new inputs are coming, and according to some guidelines are being changed. So you try to follow the latest guideline which is there. And if somebody argues, because somebody who has not updated after 2010, he will follow the 2010 guidelines, and now he will be in direct conflict with you because you are having an information in 226 guidelines information. So he is an aged person, he is a well-established doctor in that region. So whatever he will say, that will be last word of wisdom. You can to counter him. Only thing is that you need a knowledge, and that knowledge is to be updated. You say that, sir, maybe he might be wrong. Be humble, gentle, and say you might be wrong, but these current guidelines are saying like this. You can follow this one, or you can follow my advice. Okay. So what is the guideline? This you have to remember. Just note down this figure. This you have to remember. So this is the normal value. This is the impaired. See, between 1 and 2, any figure, there is a huge difference. Continental, subcontinental, from Earth to sun distance. So 1 to 2. So what happens basically? Diabetes mellitus, you write down what is the criteria for diabetes mellitus. Say this figure. Fasting plasma glucose level means when the person has not taken any food for at least 8 hours. That is fasting. And the person must be in his normal food and normal physical activity for at least 3 days preceding the test. When you are doing an investigation, that glucose tolerance test has been told to you. No. Then if you require, I will take one more class. I will tell you in detail about the glucose tolerance test. Because the person has to be prepared well. Where the doctor makes a mistake. And blood sugar you make a blood sugar fasting PP and then you come to me. But you are not giving what are the precautions he has to take. He has attended a marriage party on the preceding night or preceding day. He has taken a good amount of food. Or he was in fasting maybe in the month of Ramjan. Or in the case of Hindu, there might be a Thursday. He was on fasting. And next day he is doing the blood glucose estimation, their error will be there. So the person must remain with the normal food and normal physical activity. He might be lying down. He is not doing normal activities, or he might be having a high amount of tension and exercise on the preceding day, which is possible in the real life. So next day, don't advise you take normal food, normal physical activity for at least 3 days preceding to the test. And on the previous night, you take the meal right at about 9 to 10, because the laboratory starts usually opens at about 9 o'clock. So usually you can give a wide gap of 8 to 12 hours. Okay, normal food, normal drinking, but in the morning you cannot take a tea, anything like that. And that is the real example of fasting plasma glucose. You draw a sample. If the result of the fasting plasma glucose is less than 100, it is normal. If it is 100 to 125, which is most likely amongst most of you, some of you, you might be having an impaired. Means some problem is not normal. And if it is more than 126, at least once, that means you have gone to that stage. NEET unqualified. This is, you are in waiting for the second round. Okay, this is what is confirmed list. Okay. It is as simple as this. The first round, all selected candidates, and this is the first round. So fasting is less than 100, PP is less than, PP means after glucose, 75 grams of glucose, weighted glucose, that I will tell you in detail in glucose tolerance test. If nobody takes the class, I will take the class. Because I have an extensive work on this for almost 15 years. So I am having a good amount of research publications and a good amount of lecture experiences on lecture, delivery lecture, I will tell you in that there. So PP is less than 140 and HbA1c is another criteria. Glycosylated hemoglobin, if it is less than 5.7%, then the person is normal. Three parameters are like this, are normal. If you don't get this one, first two is normal. You do first and second one, this is also normal. At least one additional parameter you take it, because less than 100 it might not be less than 140. It might be more than 200. We don't know. So by judging, at least if you want to do it by one parameter, then fasting will be the criteria. Among all the three, are the HbA1c will be the criteria. If single sample is advised, then you have to diagnose by single sample. Then you say that either sir I will do preferably with HbA1c or by fasting glucose. Can't you do plasma PP? No, sir. You don't know what he will take and what will be his response. And diabetes is this one. It will be more than or equivalent to 120 because 125 is the upper limit here. So 126 will come. So it will be equivalent to 126 or more than 126. Here the upper limit is 119. So it is more equivalent to 200 or more. Here it is upper limit is 5.7. It is 5.7 to 6.4. So ideally I could have written it 5.6 also to make it very clear. But deliberately I have written, since I have written minus here, this part is not written. I have made it for you. So if it is more than 604, basically 605 you can write up to 605 is equivalent. Equivalent means 6.5 is abnormal. Okay, so that's why I have written 6.4. That is the main purpose. In some books of the older books, this figure might be 5.6, but they have not updated. And this is the latest guideline. Every year I am opening the new ADA guidelines, and from 2004 the criteria has changed, and 2026 this figure is, from last 4 years, this figure is 5.7. Before that it was 5.6 also. So with increased amount of information knowledge, they are updating the information. That you have to tell. Now if there is in a patient who has been admitted for the first time and you don't know what is the status, so you will draw a random sample. Random sample is regardless of fasting. Whatever food he has taken, I don't know what he has his condition. Now you do a clinical symptom with diabetes or random glucose cholesterol, if you find more than 200, then the person is presumed to be diabetic until and unless he is on drugs, some drugs which will increase the blood glucose level, or clinical conditions, how he has presented. Maybe he has come with a snake bite, or he has come with a heart attack, and he has come with under severe mental stress. During that time, abnormal blood glucose will be there. You see the assess the situation, but more than 200, you keep a close watch on it, that whether the patient is diabetic. Now, if it is more than 500, this is not normal. Suppose 225, 2022, this might come back to that stage. The most important part, what I want to highlight, because since you are all from well-off families, you are taking much more food or than what exercise you do, you are likely to remain in this stage. Because I have seen some of you maybe dancing from 5th year class, maybe doing some active playing. At the moment you entered into class 10 or 12, you stop that exercise. But the body you have deliberately set the body to function more. And that's why there will be shifting of metabolism from normal to this side. And as the year progresses, there is much more tension much more reading, much more sitting on the chair, less physical activity, more waiting, tension, it will lead to this stage. So every year, as a medical student, to be on the safer side, you do your testing at least once in a year, so that if you are in the impaired state, you make an aggressive control, you can bring it down to normal stage and maintain it, particularly body weight, eating habits, so that you don't suffer from diabetes. Diabetes complication is a major disease. From this hair to nail, entire system of the body will be affected, and you will lead a practically miserable life. That you don't allow it to do it. Now, those who have developed to diabetes, they, despite aggressive control, can bring down to this stage. It is very difficult to bring them to normal. Maybe on the lower side, with aggressive control of diet, exercise, they can come to the lower side of the lower end of this spectrum. But absolute normal is very difficult. Only in rare situation, if somebody is very much aggressive, that okay, I want to reduce my body weight to, suppose somebody is weighing 90 kilogram, if he aggressively reduces body weight, say 60 kg, so then he does a regular exercise, he can definitely bring it to this normal level also. So give a chance to every person before you start any medication. Give a chance, explain everything in detail, that you may not require anything, because if you are determined to do it, come to this stage at least, so that at least one drug or two drugs will be required, and the person will be conscious, make them conscious. Okay, that is the importance of this thing. Now, when a patient is treated to be diabetic and you will start the medication, before medication you advise for fast exercise, diet control, lifestyle modification. You see what type of life he is leading, because he has to earn something, because otherwise he will not live. So don't compromise with his activities. Then you tell him very quietly that you just modify your daily activities, so that I want not to give medicine. My basic purpose, you try to do it, come after 3 months, and then after 6 months you wait for some time before I start the medicine. And the person will be happy if the blood sugar level goes down, and it will go down. It will go down immediately, but he will not be able to make it stable. Because today you are performing, getting 80% marks. To get 80% marks in the second Prof examination, you have to be really on your knees, on your basically wheels, on your heels. To get on to final examination also 80%, again you have to be very straight, just like that. Okay. So if you start with single drug, it may come to this stage or this stage, but with the aging and progression of the disease, this one drug will be given, 2 drugs, 3 drugs, 4 drugs, and the maximum amount of drug, at the end drug will not act, and you have to give insulin. So don't take yourself to that stage, particularly if you are a family. Okay, everything I will tell you in detail, because this is not the right time. This is the end of today's class. Now if you want to know something more, I can spend